Good afternoon, everyone, and welcome to this regularly scheduled meeting of the Public Health, Environment, Civil Rights, and Engagement Committee on Monday, January 27th, 2020. My name is Philippe Cunningham, and I am the chair of this committee. With me at the dais are council members Cano, Schrader, Gordon, and Johnson. Please let the record reflect that we have a quorum and can conduct the business of this committee. Colleagues, we have 7 consent agenda items before us today with 2 discussion items afterwards. So I will go ahead and read through the consent agenda and then we will dive into discussions. So item number 1 is approving the council appointments of Tyler Piantek, Seat 9, Ward 9, and Wanda Felder, Seat 15, who is the Minneapolis Public Schools representative. Authorizing the submittal of a grant application to the state of Minnesota for Lawns and Legumes Demonstration Neighborhood Grants Program in the amount of $40,000 to establish residential pollinator habitat within neighborhoods and important pollinator corridors and pathways in Minneapolis. Item number 3 is accepting a grant from the Minnesota Department of Public Safety Office of Justice Programs in the amount of $90,000 for Inspiring Youth, the Health Department's early intervention program for young people at risk of involvement with violence. Item number 4 is accepting a grant from the the Mississippi Watershed Management Organization in the amount of $19,200 to hire interns to assist in erosion and sediment control enforcement. Item number 5 is accepting a grant from the Robert Wood Johnson Foundation and Public Health Accreditation Board in the amount of $150,000 for the Cross-Sector Innovation Initiative. Item number 6 is setting a public hearing for February 3rd to consider the reappointment by the Executive Committee of Velma Corbel to the appointed position of Director of Civil Rights for a 2-year term. And item number 7 is setting a public hearing for February 3rd, 2020 to consider the reappointment by the Executive Committee of Gretchen Musicant to the appointed position of Commissioner of Health / Director of Health Department for a 2-year term. I will move approval of all of these items. I also just want to highlight for my colleagues that if you are curious about the backgrounds for folks who are up for appointments, that is included in the RCAs that are attached to the legislative record, as well as the Inspiring Youth program has quite a comprehensive background within the RCA. So please take a look at that if you're interested in more about that program. One of the things I really appreciate about the city staff involved with this committee is that we have really robust RCAs with lots of information. So please be sure to check that out to be informed about the details of the work that's going on. So I have moved approval of all of these 7 items. Are there any questions or comments? All right, I want to welcome Council Vice President Jenkins to this meeting. All right, all those in favor of approval, please signify by saying aye. Aye. Those opposed say nay. The ayes have it and those items carry. Now we have 2 discussion items. The first is receiving and filing an update report on the Minneapolis Health Department Strategic Plan, Progress, and Activities, followed by receiving and filing an update report on the activities and accomplishment of the city's opioid team over the last 8 months. Noya Woodrich, I believe, is presenting today, Deputy Commissioner. If you'll go ahead and kick us off with the Health Department's strategic plan.
Yes, thank you, Chair Cunningham. I thought opioids was first, so just let me switch my PowerPoints here quick.
No worries.
All right. So the Minneapolis Health Department has recently completed a strategic plan. A strategic plan is something that the health department does every 3 to 5 years, and there are a few reasons for having an active and recently developed strategic plan. One, as an accredited public health organization, their accreditation board requires that we have a current strategic plan. And so we do this in order to remain accredited. Strategic plans are also crucial in providing direction for organizations, and this will provide some direction for our work plans, for our annual work plans over the next 3 to 5 years. And then finally, it ensures that the health department has the infrastructure to provide the essential services of public health. So the process for developing this strategic plan included first forming a strategic planning committee, which was formed in August of 2018. And the members included Gretchen, myself, Patty Bowler, Josh Schaefer, Leah Skefji, Allison Moore, Dane Huber, Sarah Stewart. We had representation from each of the divisions of the health department. The next thing that we did was a stakeholder survey. In December of 2018, we invited 21 different stakeholders to participate in a survey that would help inform the development of the strategic plan. Stakeholders included individuals, programs, and organizations within the city enterprise and outside of the city enterprise, all partners with whom the Minneapolis Health Department works on a variety of different issues and initiatives. And you'll see the questions that we asked of those stakeholders on the PowerPoint presentation. Secondly, we sought employee input into the process, and we did this in 3 different meetings. In December of 2018, at our annual all-staff meeting and end-of-year celebration, we did a variation of the SWOT analysis, which is strengths, weaknesses, opportunities, and threats. And we spent 4 hours working with the employees of the health department to respond to these questions and have a better understanding from the inside of what the health department needed to work on. In January of 2019, we took the responses from the December meeting and again gathered all of the staff together to hone down and make themes and create themes out of that information. And out of that process in January, we came up with the following goal areas: communications, workforce development, equity, funding and resources, collaboration, and technology. In March of 2019, we had the staff, again, participate in an all-staff event where we did a values exercise. The Strategic Planning Committee had decided that we should review the mission statement and values of the health department, decided that the mission statement was fine and that we would leave it as is, but we wanted to review the values. So at that March meeting, we went through a series of small group and large group discussions and came up with a new set of values for the health department, which I will share a little bit later in the presentation. And then finally, we did a constituent survey. So constituents are those end users of our service or end recipients of any of the services that we provide. So those are the community members. We put together a health ranking survey, and we asked all employees of the health department to get it out through their networks. We posted it on our Facebook page and on our website. And based on the feedback that we got from 190 different individuals, the top 5 health areas that they have concern about are mental health, climate change, housing with services, health equity and racial disparities, and then actually tied for 5th is access to health care, opioids, access to healthy foods, all getting 22% of that final vote. So then we took all of that information and brought it together at the Strategic Planning Committee and started to work on the forming of some goals. We decided that we would frame the strategic plan within Public Health 3.0, which is the 3rd variation of how public health does its work and designs its work. According to the World Health Organization, public health is the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. Under Public Health 3.0, there are 5 themes, and we use those themes to center the goals of our strategic plan. So first, strong leadership and workforce. The Minneapolis Health Department will have a diverse, dynamic, innovative, and qualified workforce that is prepared to lead into the future. In some ways, we feel like we already meet this definition, but we also realize that we have more work to continue to get there. This particular goal already has a work group formed around it and has been meeting since July of 2019. In early summer of 2019, we applied to the de Beaumont Foundation to be part of a cohort learning model around appreciative inquiry. There are three of us from the health department, and then Lisa Westman, our HR generalist, who attended a training in Washington, D.C. in September on appreciative inquiry. We will be implementing this appreciative inquiry process with all health department staff sometime this spring, and other stakeholders will be invited to the process. The goal of that appreciative inquiry process will be to develop a plan to attract, hire, and retain a diverse workforce. So it's a very specific goal that we hope to achieve through that process. And through this de Beaumont Foundation cohort model, we're working with 7 other jurisdictions from across the country. The other objectives of the workforce development goal area are to accommodate changing workforce needs, to create pathways for professional development, and to create a workforce environment to support and sustain employee wellness.
Deputy Commissioner, I have a question actually, if I may jump in here. One of the things that research has shown, so we want diverse teams because we want different experiences, looking at different experiences, perspectives, looking at the same challenge to be able to have different thoughts and really cultivate innovation. But what research has shown is that folks, when we bring on diverse teams during the onboarding process, essentially it creates a homogenization back to the dominant culture. And so folks then it kind of helps then diminish the innovation and the different perspectives, because it's like we go back to the dominant cultural norms. How do we help prevent that from this perspective in this work? Because I think that also might be one of the reasons why we have a hard time retaining a diverse workforce, is because folks feel like they have to then conform to certain kind of norms. So do you have any thoughts on that?
Yes, Chair Cunningham, thank you. I've only been here a year and a half, and so my orientation to the city process is relatively new. And I would say that we need to work on our orientation process. And it is one of our strategies in this goal area to review how the health department orients its employees. When I started, I received the city orientation, which, tells me how to access my healthcare benefits and such. And then I, because of my position, spent more time with Gretchen and Becky to really understand some of the day-to-day of the work. But there was no orientation to organizational culture. And I think, personally, as someone who had the luxury of working within my community for so many years, to come and work outside of that community, I think learning the culture of the organization was probably one of the biggest learning curves, and one that could be daunting if you didn't hold a position like deputy commissioner. If you were someone who was a public health specialist or an administrative analyst or environmental specialist, that learning of and understanding and how to operate in a different culture is probably one that might turn people away. And so I know that for me, and my work in this area, paying special attention to our orientation and how we welcome people of color into the city will be a big focus area.
Thank you so much for sharing your experience and perspective on this. The other question that I have is around leadership development. So one of the things is that we want to make sure that we are also, so we have frontline workers, who are out there doing the work every day. We want to move them up into management positions. One of the challenges that we have is that from those of us from diverse backgrounds, is that sometimes leadership development doesn't fully tell us the truth about our experience, that there are going to be additional barriers that sometimes get in the way of systems that were not originally created for us. Maybe not so much a question as just kind of like throwing that out there to take into consideration with the workforce pipeline work or the leadership pipeline work, is like, how do we prepare leaders of color to be resilient in the face of really institutionalized oppression that just kind of is in the gears of the system moving. So just wanted to add that as well. Seeing no other question, unless you have something to add, please, by all means.
Thank you, Chair Cunningham, and I will, I agree. One of the mantras, or something that comes up in every discussion of the work group that we have formed around workforce development, is leadership at every level. So we realize that leadership isn't just positional, and that we have people that aren't in management that still are leaders, and we want to foster that and help them grow. Thank you. The next goal area is strategic partnerships. So the Minneapolis Health Department will be an authentic partner within and without. It's a very simple statement, but what it means is we want to be real with each other and with those that we work with. We will, in this area, work to improve cross-divisional collaboration. So as many of you probably know, the environmental health programs and environmental health have recently come back to the health department. Well, maybe not recently, 4 or 5 years ago. But that's still because of the, because part of us are located on 5th floor and part of us are located on 4th floor. We're still working to find ways where we can work together and cross-divisionally. And so the work of this particular goal area will include developing and learning ways in which we can work together more effectively to achieve our goals. We will work to improve our collaboration with other city departments. I think we all already do fairly well in this area. My experience through the opioid work, which you'll hear about in a bit, tells me that this is really a must and not an optional. And so we're working really hard to find ways that we can work with other departments. And then finally, we will improve our collaboration with external community partners. I would say that for jurisdictions, the city of Minneapolis has the best reputation for working well with community, and we need to continue that, but that doesn't mean that there's room for improvement. And we will be looking at things like our contracting process and our public meeting process to ensure that we are engaging all parts of the community and offering opportunities for concrete partnership to all parts of the community.
I just want to jump in and give a shout out. I actually just said this morning that bragging a little bit on the health department, that from my perspective, the health department is the most collaborative department in the city, both working across departments, really breaking down silos, and also having a lot of credibility in the community and working with community partners. It's not a competition, but if it was, you win. Just kidding. So thank you for that. That's really critical in building credibility, both within the enterprise as well as out in the community. And you all have shown tremendous leadership in that way. So thank you for continuing to build on that.
Thank you. The next goal area is flexible and sustainable funding. The concern that initially came out of all of our information gathering was that there was not enough funding. But when we really drilled down into it, it was that we need to really focus on sustaining our funding. As a department that is largely grant funded, we are constantly in the mode of fundraising, and grants can run 1 year, or they can run 5 years, or they can run 20 years. But when you don't know the answer to how long they're going to run, we always are in that mode of worrying about whether we're going to have enough money for the next year to continue to provide the services and work with our community partners. So we're really going to focus on establishing and building a more sustainable funding model. This means that we will need to work on increasing the proportion and amount of flexible funding So funding that's not designated to a particular purpose, but funding that we can apply to the areas where we most need it. We will seek to increase funding for equipment upgrades and needed supplies. So having the materials, the most up-to-date materials that we need in order to do our work will actually help us in the end develop sustainable funding. We will align resource allocation to support department strategic priorities. So where we do have flexibility, we will put that money where our mouth is and spend it on those issues that are most important to the community. We will build community capacity to sustain public health efforts. So a great deal of our money that we receive from grants goes back out the door in the form of grants to our nonprofit partners and our other community partners. And while building our own sustainability, we also want to help them build their sustainability. And then just build our infrastructure to increase our ability to seek, apply for, and be successful in receiving additional grants. Next is timely and locally relevant data, metrics, and analytics. The Minneapolis Health Department will have the tools and technology that assures we can provide accurate and relevant data. We are actually partnering closely with IT. Beth Cousins was actually our point of contact, so we'll need to figure out who the next point of contact will be. But we're working with IT closely to make sure that they understand what our needs are and that they can help respond to them in a timely and efficient manner. We've discovered that for the IT tools that we have, not everybody knows how to use them most efficiently. So we'll be implementing some training to help people know how to use the tools that they have available to them. We will support a dedicated position to define needs and facilitate solutions. We actually did that. We have that position that started mid-year last year. And she was a current city employee that came to help work with us on this issue. And then we will expand methods for making data and information available to the public. And finally, in the area of foundational infrastructure, there are two goals. One has to do with equity, and the other has to do with communications. The Minneapolis Health Department will have a core infrastructure that is prepared to serve and support the division as we advance in public health in Minneapolis. Under the area of equity, we also have a work group formed in this area, and that work group started its work in August of 2019. I'm leading the work on this particular issue, and we've already had one staff event in December where we started our conversations about equity as a health department. There's a lot of crossover between equity and workforce development, and so we are intentionally working together to make sure that we are striving towards the same goal in this area. We are also, as a health department, beginning work to become trauma-informed, and there's also a great deal of crossover there. So we're including all of this stuff under an umbrella, under the equity umbrella, so that we can improve not only our outcomes for community, but the organizational culture of the health department. Under equity, we are looking to define equity, what it looks like and feels like for the health department. We will be creating a framework of equity through which we can run everything that we do. So we know when we're taking projects or initiatives out to the community that we're doing it in an equitable way. We will create an equity policy for the health department that builds equity into everything that we do. We will and have created a training plan for all staff. For Perform Minneapolis for 2020, all health department staff will be required to include a goal around equity. And the equity work group has provided 15 different options for staff to choose from, so that there are certain requirements met by each of those performance measures. And then we will finally include equity in our contracting process, and we've acquired a tool from Race and Equity team that we will be starting to implement in reviewing our contracts for equity purposes. Under the communications goal area, Patty Bowler will be the lead on this. This committee started meeting in July of 2019. A consultant has been hired to write a communications plan for the health department, and a committee has been formed that is made up of the communication points of contact from each of the divisions within the health department. We look to improve bi-directional communications to the community to make sure we're not only telling, but we're hearing and listening. We want to create opportunities for improved internal communications, and that's internal to the department. And then we want to create an external communications plan, which we're working on, and implement it so that we at the health department can speak in a unified voice about the work that we're doing. So next is how we do our work. And this is what was developed out of that values exercise that took place earlier in 2019. I won't read it all to you, but I would encourage you to take the time to read it on your own, because it really talks about how we as health department employees want to be, not only with ourselves at the health department, but with our outside partners, both within the city and in the community. And in working to invest in healthier communities, exercising leadership in public health, practicing continuous improvement and protecting people from harm, we want to make sure that we're doing that in the right way. And that's all described here in this document. And then moving forward, so a new rendition of the Strategic Planning Committee has been formed. This group will meet just twice a year to monitor progress of the work groups and to advise as needed. Some of these are time-limited efforts. So when we look to the IT work and the fundraising and resources work, those work groups will be meeting for a limited amount of time to develop a plan and then implement it, whereas things like equity and workforce development will be ongoing efforts of the health department. And then the community health assessment is something that we are finishing up right now, also required for reaccreditation. And out of that, we will develop the community health improvement plan. That data that we gathered from the constituents that highlighted the health issues that they're concerned with, you don't see that in the strategic plan. You will see it in the community health improvement plan. And our goal for the next cycle of strategic planning is to align the strategic plan development with the community health assessment. We were just a few months off from each other this time around. Next time around, we'll do those together so that we can be more efficient with our planning. And that is all I have for you with strategic planning.
Thank you so much for that informative presentation. I have a question or comment from Council Member Gordon.
Yeah, I just wanted to take a moment to comment about how impressed I am with the thoroughness that you went through this for, and actually I think digging into some things that could really make a significant difference. I really appreciated focus on the workforce and also goal setting, and I think there's some of the tools that you might be developing, including the well, maybe the menu for the equity goal for each staff person to develop, and also looking at those contracts through that equity lens. It could really be useful for other departments and other entities in the city. So appreciate getting this report and hearing about how you're doing this strategic plan. And I really liked it being broken up. So we're hearing about the internal plan, about how you're going to really improve the functioning or realize or maximize anyway of the department. And I'll look forward to hearing about the community improvement plan and in the future. So thanks so much.
Councilmember Schrader.
Thank you, Mr. Chair. I also just want to echo that this the work you've done, it looks fantastic. Just really appreciate that. On a side note, I did want to follow up a little bit on the decision to not renew the contract with the county on epidemiology. Could you elaborate on that a little bit?
Yes, Chair Cunningham and Councilmember Schrader. Yes, if you didn't bring it up, I was going to. So thank you. This has received far more publicity than we ever imagined it might. I was actually just at a meeting this morning with Chris Arisman, who's with the Minnesota Department of Health, and she oversees the areas that we are looking to assume responsibility for at the health department. we do intend to discontinue the contract with Hennepin County. We have already assumed responsibility for foodborne and waterborne illness. We've handled our first epi case just last week as it comes to foodborne illness. That is the area where we were most equipped to start because of our own environmental health division and the health inspectors who already have a lot of experience in this area and have worked closely with Hennepin County in the past. And that is going well so far. We started that January 1st. Our next hope is to assume responsibility for the epi work as it relates to vaccine preventable diseases. So that's measles, flu. And specifically, that is what I went to meet with Chris Arisman about this morning, to get in touch with the appropriate people at the Minnesota Department of Health to understand what their expectations will be of us in that area. Our plan, as it has always been, is to transition this change over the next 12 months and not just immediately assume all of it. We continue to get information to the county as we are required or need to, and we look forward to having conversations with them about continuing our work together.
Thank you.
All right, thank you so much. Are there any other questions or comments from my colleagues on the strategic plan? All right, seeing none, I move approval to receive and file the updated report on the Minneapolis Health Department strategic plan, progress, and activities. All those in favor, please signify by saying aye. Aye. Those opposed say nay. The ayes have it, and that item carries. Moving right along to our last item on the agenda for today, we have an update on the opioid epidemic activities.
Thank you, Chair Cunningham. We are a couple months late in getting back to you on this. I apologize for that, but we have been busy. This first issue that I'm going to talk about is actually not one that was on anybody's work plan, but starting last spring, about a year ago actually, we started hearing more and more concerns about the syringe litter problem. We were hearing directly from community members, from business owners. We were hearing through your offices. We were hearing through the mayor's office about the residents and business owners' concern about the litter issue. Syringes were in fact littering Minneapolis streets. That does create a public health hazard. We've heard stories of children in playgrounds pricking themselves on needles. And it created a threatening environment for residents, visitors, and city employees. So we set about gathering information to clarify the source of the problem and just to better have an understanding of the problem. We worked with other cities and jurisdictions who had responded to the same issue to learn about what they had done. Minneapolis-specific solutions were identified and implemented. And we continue to monitor the solutions that we've implemented thus far. Because there was no one in an official capacity picking up syringe litter, residents, business owners, local nonprofits, and city workers across the enterprise, including police and fire, were collecting syringe litter. Residents and others were not aware of the safety standards for picking up syringe litter, and so we're creating greater health risks as a result of that. And part of our education has been to inform people how to safely pick up syringe litter. We were seeing things like this out in the community, kind of homemade receptacles put out on the streets in a way, in an effort to help with this particular problem. If you know about syringe litter, this is not an appropriate way to do it because a milk jug is too penetrable. You need something with a little bit more durable plastic. But community was doing what they needed to do. So this is what we created. One response. The syringe dropbox. This was actually designed and built by a local business If you're familiar with the Snoopies located around the Twin Cities, the woman that designed and built those Snoopies is the same woman that designed this box for us. It's a company called Tivoli 2, and we worked closely with them to come up with the design and colors that match the city of Minneapolis colors. We were intentional to not use words on it, but pictures, so that language would not be a barrier. People would know what this box was for. We were very intentional in the design. What we learned from other cities is that had bigger openings for the syringes is that they were getting not only syringes, but every other kind of litter in the boxes. So we intentionally designed a box that had an opening that only a syringe could fit in. And you'll see the little hood over the top of the opening to help prevent it from filling with snow and rain. It is graffiti resistant. The design is attractive and non-threatening, and we've installed these in the neighborhoods that were experiencing the highest level of syringe litter. On the next slide, you see a listing of where those are currently and where they are located. Yes, they are all in South Minneapolis right now, because that is where the worst of the problem resides. There are 4 located in parks, and the park folks took care of installing those and will maintain them. For the ones that are located outside of parks, we have developed a close relationship with the Public Works Department, and they will maintain those boxes located outside of the city parks. We are, within the next week or two, installing our first in North Minneapolis, so we are going to start looking at some other areas. The second thing that we implemented was was these buckets. So we heard a lot from businesses, mostly along Bloomington Avenue, along Franklin Avenue, some on Lake Street, that they were having to pick up a lot of syringe litter on their own properties, but they didn't have a way to get rid of it. So these boxes, these buckets, we've started with 30 of them. A business owner located in South Minneapolis or other parts can get one of these, and when it fills up, we will send someone out to empty it for them. Along with the bucket, we've given them policies for how to handle the bucket. This is not something that should be placed out in public for people to just put stuff in. This is something they should be keeping in the back for their own purposes. And then we've, again, developed a relationship with a vendor who will come and empty those out. Some of the places that already have these buckets are the Taco Bell on Cedar Avenue in Franklin, the American Indian OIC, Ingebrigtsens on Lake Street, R.S. Eden, Allied Universal, Open Arms, and then there are a handful of apartment buildings that have these buckets already. And then the other thing that we implemented in relation to this is when, prior to us implementing some of these efforts, when people had syringes that they needed to pick up and they didn't want to pick them up on their own, they were calling 311, and 311 was deploying the fire department to go pick up these needles. And the fire department would send a truck full of fire persons to pick up anywhere from 1 to 100 needles. And so the other thing that we implemented was when 311 receives a call that has 30 or more needles, they're to call Industrial Hygiene Services, which is the company who we're working with, versus the fire department. And Industrial Hygiene Services will go pick out those needles. The fire department has reported to us that they've seen a reduce in calls since implementing this. We've also worked, this is a picture of Tim Huber from Industrial Hygiene Services. He's doing a lot of the education for us. We've had a couple of community events that he's been to where he instructs people about how to pick up syringes safely and how to dispose of them. In March, we will be having 4 internal trainings on safe cleanup, and this is specifically in partnership with Public Works Department. There's already over 100 employees that have expressed an interest in having this training. If these go well, we'll broaden that to other parts of the city enterprise. So these boxes have picked up over 1,000 syringes so far. We did see a decrease because of the winter months, so we anticipate that in spring, when it starts getting warmer again, not that we've had too harsh of a winter, most of the syringes have come out of the box that's located on Bloomington Avenue and 25th Street. That's where there was a little homeless encampment setting up. And so that's where we've seen the most needles. The second most popular location is on Cedar Avenue and in between Franklin and 24th under the bridge, under the Hiawatha overpass. We have seen a decrease in 911 and 311 calls about resident complaints and fire and police having to go pick up syringes. And we've already had other cities contact us about our model to see if it might work for theirs. I talked to Milwaukee last week, and St. Paul Ramsey has contacted us as well. So next steps. This box that you see in this picture is actually one that Public Works built. Those boxes that we had designed and built by the local business owner run us about $2,500 a piece, which we can afford, but if we can do it internally and save some money, why not? So they took one of the boxes and built one of their own. So if we decide to expand the program beyond the 11 boxes, we have an internal source for getting those built. This one is the one that will actually be going into North Minneapolis in the next couple weeks. The other thing that we're looking at, if you can look at this particular picture, the way these are mounted is that they're mounted right to the cement sidewalk. We're looking at mounting them to a cement slab that a forklift then could go pick up and we could move instead of Public Works having to go out every time and unscrew the box and move it and screw it. So we're looking at different portability models to improve effectiveness and efficiency there. Finally, with the syringe boxes, when spring comes around again and we have a better sense of where the highest need is, we will be moving boxes as needed or expanding.
Do you know where the location for the North Minneapolis box is going to be?
Not yet.
Let me know. Thanks.
Next, the hospital and community-based program. So this is the one that's included in general fund for 2020. We also secured a federal grant from the Department of Justice to help support this program. We are establishing appropriate relationships. These relationships are not set in stone yet, but we've been having a ton of meetings with potential community partners, including Hennepin Health, Native American Community Clinic, Serve Minnesota Recovery Corps, and the fire department. The model is based extensively on our own Next Step program and informed by our technical assistance relationship with the New York City Department of Health and Mental Hygiene. They have a similar program called Relay in New York. I don't have a ton more detail on this, but it will be an emergency room-based response program to those folks who come in on an overdose. And then we are establishing a similar model in the community for those people to whom first responders administer Narcan or naloxone, but they do not go to the hospital. We are designing a program so that we can connect with them as well. We also received a grant from the Minnesota Department of Human Services to, in Minneapolis, be the hub for Narcan distribution, at least the Narcan that comes from the Department of Human Services. And we've partnered specifically with Southside Harm Reduction Services and Native American Community Clinic. They will be distributing naloxone/Narcan, and they will be doing education in the community about how to administer Narcan safely and effectively. And we'll also be providing some education internally to the city to folks who are interested in that. This program, we're still working out the contract details with the state, but we will be starting this within the next couple months.
Is the grant paying for the partnerships? What does the grant cover? I'm curious.
Yes, Chair Cunningham. The grant will cover sub-grants that we're giving to these two named organizations. And with it, they will be hiring staff that can do the outreach and education. The naloxone itself is just provided by the state at no cost to us or to those organizations.
Great. Thank you for that additional info.
Yes. Next, I want to talk about a mortality review project that we participated in last year. Our partners for this particular, or the purpose of this is to better understand the overdose fatalities that we're experiencing here in Minneapolis. We want to improve system response, mitigate risk, and promote interagency collaboration, and prevent future overdose deaths. We partnered with the Minnesota Department of Health and the Minneapolis Police Department, with an occasional subject matter expert invited into the process. This review process is based on one done in Milwaukee by the Milwaukee Homicide Review Commission, and was done with assistance from the Bureau of Justice, University of Pennsylvania Law School. The recommendations that came out of the mortality review process, well, let me back up. So we reviewed 6 deaths because this is a pilot program. We looked at the deaths in the second half of 2017 that occurred in Minneapolis. There were some 30-some deaths during that 6-month period. We decided that 6 is what we would review during the pilot process. We intentionally chose people whose deaths we wanted to review based on race, gender, and age. We wanted to make sure that the deaths we were reviewing reflected the entirety of the deaths that occur here in Minneapolis. And so we reviewed 3 men, 3 women, 2 African American, 2 American Indian, 2 other. We made sure that we reviewed a death of a homeless person, of a younger person, of an older person. We really tried to cover the gamut with those 6 deaths that we reviewed. It took us to review 1 death. It took us on average about 2 to 3 hours. And so we would have a meeting and we would review 1 death. And we met from late summer of 2018 through this spring in order to do that entire process. Then the group met to form recommendations based on the information gathered from the deaths. And those include increasing and improving wraparound services and linkages to care, expand access to naloxone, increase the availability of medication-assisted treatment, particularly in jails and upon discharge from jail, and then improve culturally relevant services for American Indian and African American populations. These actually match nicely with the recommendations that came out of the Mayor's Multi-Jurisdictional Task Force, and they match nicely with everything that we've heard since in terms of concerns coming from the community and other service providers. We actually are interested in continuing this process, though the Minnesota Department of Health is moving on to pilot this with other jurisdictions. We here in Minneapolis would like to continue it on our own. We would consider doing a rolling review versus doing periodic reviews. We need to secure funding to do this. We're establishing and determining what a budget might look for so that we can look for funding to support such an ongoing process. We would have to establish a committee of those people that would be responsible for reviewing the deaths, and then we would look to how we publish and use those findings. So this is something we'll look to be moving forward with. And lastly, in terms of some of our big buckets of work, is an anti-stigma campaign that we're working on. This campaign will, by and large, be geared towards the Somalian community. And that's based on information that we've heard and gathered. We had an initial meeting held 2 weeks ago with Congresswoman Omar to exchange information, establish priorities. As we hear them from the Somalian community, there were multiple other jurisdictions invited to that particular meeting. It was highly informative. We also participated in a listening panel in a discussion at the Brian Coyle Center, and that was hosted by Representative Noor. Through that, we met a group called Generation Hope, which is a group of young Somali youth, all of whom have experienced addiction to opioids and have come out the other side. And they are very concerned about doing something for their brothers and sisters in their community. We're also working with a group of mothers that is interested in doing something in the Somalian community. And all of these meetings and relationships that we're building will inform the message of the Anti-Stigma Campaign. Again, we're working closely with the New York City Department of Health and Mental Hygiene, who has established an anti-stigma campaign in New York City, and they're helping us to develop this particular project. We hope that we will be able to get a message out into the community that will help youth in this community understand that there are people who can help them, and will mitigate some of the stigma that they and their families are experiencing as a result of that opioid use. We've heard stories of families who will not tell the truth of why their child died because it is too embarrassing to them. And this is a real problem, and it's affecting all communities in Minneapolis, but we want to work closely with this community on this particular effort. So as we form the messages and do more work in this area, we will keep you informed as well. Strategic partnership development. It was when Suzanne and I were working on this presentation, it is a little hard to remember everybody that we've been meeting with, because we've been meeting with a lot of people, developing a lot of relationships, but we wanted to mention a few. The Annie Casey Family Foundations program actually approached Suzanne and asked if we could do some partnering as it relates to the housing of those experiencing substance use disorder. We have improved enterprise-wide relationships for the sake of this opioid work, particularly with Public Works and the fire department and the police department. In April or May of this year, we're going to be doing a youth summit, co-hosting a youth summit with Augsburg University. Community hospitals and clinics, I mean, the number that we've met with would be amazing. And then Twin Cities Rise, which is a work development organization. So these are just a few of the organizations that we've worked to develop relationships with. Just a few other notes. We continue to seek funding for this work. There's a lot of work to be done. We've been able to pull together nice chunks of money thus far. We need to do more. We're actually currently reviewing a possibility now that would support some of the work that we in the fire department are working on together. We will continue to develop our relationship with the fire department. They're experiencing this phenomenon where people are showing up at the fire stations seeking resources around opioids, so we want to figure out how we can help respond to those folks. We're working closely with other jurisdictions, both here in Minnesota and outside, to understand the work that they're doing and how that could work here in Minneapolis. And then finally, I just wanted to mention that we are going to be at the Neighborhoods Conference this next Saturday, both having a booth to provide resources to people, and we will be doing a presentation. So we're trying to get the information out as far and wide as we can. And that is all I have.
Thank you so much. I have a question or comment from Councilmember Gordon.
Thank you so much, and I really appreciate the update. And I'll be curious to hear more about the mortality review and what the budget might be to do that. I think that could be very helpful, especially as we gather the findings that we have and then try to do interventions and kind of see how that works. So I appreciate that. I did want to ask, sort of as a point in time update about how you see the problem, or if there's any metrics that we're tracking to understand if it's getting worse, is it getting better, is it staying the same? You mentioned a little bit about syringes, and we're not getting as many complaints about them, which could indicate something good, or just that we're managing the problem better. But we don't just want to manage the problem. We want to, or we do want to manage it so well that it goes away, because we solve it. So in terms of, I mean, we could look at things even in terms of deaths from overdoses, and that could mean we're managing it by reducing those because we're getting more the right medicine out there. But what's your impression right now, or do you have any statistics you could share with us?
Chair Cunningham and Councilmember Gordon, We were trying to find newer statistics for the presentation. The challenge is we rely heavily on the Minnesota Department of Health to get our statistics. And for 2019, they haven't finished processing all of that information. I think you described it well. We are managing a problem right now, and we need to move towards preventing the problem. And preventing does come by managing it, but we also have to do some very outright prevention work. And that's in the recommendations that came out of the mayor's multi-jurisdictional task force as well. So we just, one of the other things that we wanted to do was a youth-focused prevention program. We just need to find the funding to do that, to be a little bit more forthright. The other thing that we're seeing in other parts of public health, we are hearing about an increase in HIV diagnosis. There is an epidemic of hepatitis right now, and all of this overlays with the same population that is using opioids. And so we're going to have to start looking at how we can reach out to these people for multiple purposes. And part of the conversation I had this morning with Minnesota Department of Health was about that very issue as well. How do we jointly reach out to the communities most in need here and help get at some of the root of this problem?
I appreciate that. I also, I know that it makes sense we talk about it as an opioid response and an opioid problem, but what I'm understanding is often it's methamphetamines just as much as it is opioids, and it's a circular or it's mixed, the dependency issue. And I know that we understand that, and we're looking at it more holistically than just about opioids, but I think it's important that we remember that. I also just did want to emphasize I really appreciated the work on the stigma, and I do think it particularly seems to be more challenging in some communities like the Somali East African community, although I'm sure that all of our kids would hide it from all of us, or if we were in trouble, we'd hide it from our kids, if you know what I mean. I mean, it's such a stigma. How can you even ask for help because you're admitting you got yourself in this much of a serious problem? But we do need to start looking at it that way, and because getting help is what the best thing you could do, and you need to share that with somebody so you can get that help. So I really appreciate that you're looking in how you can do that. I actually had a chance to talk to the youth workers who were working in Cedar Riverside and in the Seward areas, and they talked about how many conversations it took with young people and individuals to finally get them to open up to the problem and end up going and seeking treatment and getting help. And so we really have to kind of build those relationships, and it just showed me that it is such a big problem, and keeping it a secret just makes it worse. So appreciate your work and appreciate the update.
Thank you. Are there any other questions or comments from my colleagues? All right. Seeing none. Yes, please.
Chair Cunningham, I forgot two things. One is, starting in February, we will be doing a biweekly report, and you all will be on the distribution list for that, because we get regular inquiries about what's going on with the opioid work, and so we want to be responsive to that. So starting in February, every couple weeks, you should receive something from us updating you on the work that we're doing. And then back to the contract with Hennepin County. Councilmember Gordon, I promised you something on Friday, and I didn't get it to you Friday, but we're finishing it up right now, and you will have it before the end of the day. Thank you.
Just for full disclosure, I just asked for kind of a written rationale about why we're making the change, and something that could come from the health department, so we could share that with county commissioners and others, and that's what you're talking about.
Yes, yeah. And we actually plan to send it to all of you.
Excellent. So I want it should be a public thing for all of us to share. Thank you.
Great, thank you. I would like to make the recommendation for the syringe dropbox to be on Broadway and Lindale. I was further thinking on that and just wanted to make that recommendation. With that, seeing no further questions or comments from my colleagues, I move approval to receive and file an updated report on the activities, accomplishments of the city's opioid team over the last 8 months. All those in approval, please signify by saying aye. aye. Those opposed say nay. The ayes have it, and that item carries. Seeing no further business before the committee, we are adjourned.